right, please let me know if you can't see or hear me. Hi, everyone. My name is Marissa Chan, and I'm a PhD student at Harvard Chan. I work with Dr. James Todd in the Environmental Reproductive Justice Lab. And today I'm going to be talking about some of our work focused on retailer redlining and evaluating neighborhood level differences in hair product safety in Boston. So this is just a really brief overview of my presentation today. I'm going to be starting off with some background, leading into the study focused on retailer redlining, and ending with what's next for me and some of the work that we're doing in this lab. So starting off with some background, racial and ethnic disparities in women and children's health outcomes are well documented in the US. And these disparities can be observed throughout the life course. Some examples include preterm birth, the early age of menarche, and uterine fibroids, and as we heard in depth through the previous two presentations, breast cancer. In some cases, these disparities are not only persisting, but increasing. Personal care product chemical exposure, or PCPs, is hypothesized to be one contributor to these disparities. And concerns really stem from exposure to endocrine disrupting chemicals, which we also heard a lot about. But just to quickly define, these are synthetic and natural substances that can interfere with the body's hormonal processes. Some examples of personal care product associated EDCs are phthalates and parabens. And in general, EDCs are used for their desired properties, including as preservatives as well as antibacterial agents. So adding an additional dimension to this background, racial and ethnic disparities in exposure to personal care product associated EDCs are also reported. As an example, Black women are found to have higher urinary concentrations of low molecular weight phthalate metabolites, as well as parabens compared to other racial ethnic groups. And these reported disparities in exposure may be driven by differences in personal care product use patterns, notably hair product use. Furthermore, these commonly used hair products used by Black women, some of which are shown on the screen, are found to be hormonally active as well as to contain EDCs. So hair product use is typically viewed as an individual level behavior, and the result is that there's this harmful narrative and there is this blame that is placed on individuals, most notably those among the Black community, where we are jointly told that our hair is unprofessional and unkept, while also told that we should know better than to use hair relaxers. And in some ways, there is this double jeopardy faced by the Black community, but more specifically, Black women and girls. Research has previously identified some of the individual, interpersonal, and societal level drivers of personal care product use. However, the broader drivers of hair product use and availability, including the role of place and policies in the context of neighborhood, have not yet been fully evaluated. And one potential driver at the community and neighborhood level is retailer redlining, which is the discriminatory practice of not serving certain communities or providing differential treatment based on the socio-demographic composition of the customers or neighborhood. So to begin to explore a dimension of retailer redlining, we aim to examine if the safety of hair products is associated with socio-demographically diverse neighborhoods in Boston. Moving on to how we conducted this study or the methods, we selected neighborhoods for our study based on three considerations. The first was percent race ethnicity, and we included neighborhoods with the greatest percentage of Black, white, Asian, and Hispanic residents. Next, we considered socioeconomic status, or SES, and we selected communities based on percentage below the poverty line to reflect higher and lower SES. And lastly, we selected two communities, Dorchester and Roxbury, which have a mix of racial, ethnic, and socioeconomic identities of their residents. So for the purposes of this study, they were considered more diverse, but in general, they are lower income communities of color. This map on the right just shows our 8 neighborhoods in the study area in the context of Boston, which is outlined in Black. And also on the left is the socio-demographic variables that led to the neighborhood's inclusion in our study. So as an example, Beacon Hill, which is our comparison or reference neighborhood in our analysis, was included based on the fact that the residents are predominantly non-Hispanic white and higher SES. Moving on to how we identified stores or retailers, we used North American Industry Classification Codes, also known as NAICS codes, and these are really just codes used by federal statistical agencies for classifying businesses. And we included the codes for pharmacies, department stores, grocery stores, and beauty supply stores. 198 stores were identified in the 8 neighborhoods, and we determined if they were closed, not at the provided address, or a specialty market that would not sell hair products, for example, a meat or a seafood market. And we included the remaining 109 stores into our target population. From these, we took a random sample of 4 stores of each store type within each neighborhood with some caveats, which are listed on the top of the screen. So if there were less than 4 stores for a certain store type, all of the stores would be included into our analysis. For communities with more than one of the same store, we did a separate random selection to ensure that only one of each would be included. So just as an example, CVS was one of the 4 pharmacies that was included in Dorchester, which was randomly selected from the 6 CVSs in the area. This resulted in 52 stores, and we were able to visit 50 from January to March of 2021. Finally, in terms of data collection and entry, we took photos of the hair product sections of each store. And from these photos, we entered the brand name, product type, product name, and price into a database. All products marketed to women and girls were entered into our database, except for the products listed on the bottom of the slide here. And lastly, for product safety, we included the Environmental Working Group Skin Deep Database Hazard Score, which ranges from 1 to 10 and is categorized based on low, moderate, and high hazard. We heard a little bit about the EWG database, but just to give a little bit of a description, the Skin Deep database is a consumer-facing website which allows individuals to search for a certain ingredient or product and to find an associated hazard score. EWG also has its own score called EWG Verified, which is positioned below the score of 1. And this is given to products that are free of chemicals on their unacceptables list, that follow good business practices, and are transparent in terms of their ingredients. And now finally for the results, we cataloged or captured through our photos 14,019 hair products in the 8 neighborhoods that we had identified. Just a note in terms of moving forward for the results, because we could only find these EWG hazard scores for 9 of the 159 products cataloged in Chinatown, we unfortunately had to exclude Chinatown from our analysis. And this lack of data really raises important questions regarding how different diverse communities may have barriers to not only safer products in their communities, but also consumer-facing information about the products sold. This table on the screen shows the count and percent of hair products grouped by EWG hazard categories, as well as Pearson chi-square tests, which basically just compare the hair product hazard scores in each neighborhood to Beacon Hill, which again was our comparison or reference neighborhood. Just as a brief descriptive look at the data, Beacon Hill had the highest percentage of low scoring products and the lowest percentage of high scoring products compared to the other neighborhoods. Mission Hill had the lowest percentage of low scoring products, and Roxbury had the highest percentage of high scoring products. Additionally, in terms of the chi-square tests, only the comparison between Roxbury and Beacon Hill presented a significant difference, which is shown at the bottom through the p-values. So now I'm just showing a portion of our main results, and this map presents the relative risk of finding hair products with high EWG hazard scores versus hair products with low EWG hazard scores, comparing each neighborhood to Beacon Hill, which is again the reference neighborhood. Mission Hill, which is shown here, and Roxbury, which are both lower SES and or lower SES communities of color, had more than a twofold higher relative risk of finding these high hazard hair products. East Boston, Dorchester, and Mattapan, which are also communities of color, also had higher relative risks. Just as a note, Roxbury was the only neighborhood where the 95% confidence intervals did not encompass the null, which means that Roxbury was the result that was statistically significant in this analysis. Now, briefly to go over some of our other results. Since concerns stem from certain leave-in products due to the extended amount of time that the product is left on the skin and scalp, we separately examined the association between neighborhood and EWG hazard score by product type. For the rinse-off products, there was an elevated relative risk of finding products with high versus low EWG scores in East Boston and Roxbury compared to Beacon Hill. And for leave-in products, the highest relative risk of finding products with, again, high versus low EWG scores were reported in downtown and Roxbury. Also, just a note about the leave-in and rinse-off analysis. These should be interpreted with caution, just based on the fact that there was a small number of leave-in low-hazard hair products in most neighborhoods. Finally, we examined some associations with price, and lower SES communities were found to have lower priced hair products. And there was a significantly lower relative risk of finding products in higher quintiles of price in Dorchester, Mattapan, Mission Hill, and Roxbury compared to Beacon Hill. On the other hand, higher priced products were found to have lower EWG scores. So in other words, we are presenting evidence that lower SES communities have less access to safe products, since higher priced products had lower EWG scores, which indicate that they are safer. So just as a really quick summary, we observed disparities in the overburden of unsafe hair products based on neighborhood sociodemographic factors, and neighborhoods with a higher percentage of residents of color and lower SES residents had less safe hair products. So now you might be asking what's next in terms of this work, and that is the ReStyle study, which stands for Retail Environment and Hairstyling Exposure Study. It is really currently still in development, but one aim will dive into retailer redlining more and evaluate if there is an association between historical residential redlining and retailer redlining of hair products in Boston. And so we are currently expanding the data collection to all neighborhoods in Boston. So stay tuned for more and to see the progress of this work. And finally, just a huge thanks to all the folks on the screen, specifically my advisor, Dr. James Todd, for the support over the past few years. Also, a lot of gratitude and thanks for the folks who've helped out with data collection and data entry. The project I just presented on, as well as the ReStyle study, definitely could not be completed without all of their support and help. And lastly, just a huge shout out to all the California folks, including Dr. Bhavna Shelmasunder, Black Women for Wellness, as well as all the community folks and groups that I've worked with and alongside. I've learned a lot from all of you and over the years, and I definitely would not be where I am now without you all. And that is it for me. Thank you all so much for listening. And my email is just listed on the screen. Please feel free to reach out if you'd like to chat more about this or ask any questions. Thank you all again.